If you have auscultated a murmur in their epigastric area, please do not palpate the abdomen.
They probably have an aortic aneurysm. And you blow it, there it is.
Oh, that makes me want to push on their tummy.
But
All right.
the other thing is, if you palpate before you inspect, auscultate, all that, you can change bowel sounds. Bowel is very naughty little organ. It doesn't like to be messed with. It doesn't like to be touched. It goes to sleep. It hides on you. And heart and lungs will kill you very fast. Your gut will kill you, but it will take a long, miserable time to do it.
Have the client void before the examination. A lot of people forgot to do that, so make sure you verbalize it. Position the client supine with the knees slightly flexed. Start by inspecting. Observe the size, symmetry, and contour of the abdomen, just like you did for the basic nursing physical exam. Observe the condition of the skin color. Look for lesions, scars, striae, superficial veins, and hair distribution. Note abdominal movement. So you're looking just for how the abdomen.
Sometimes you can see the peristalsis. And a lot of times you can see the pulsation.
All right, listening for bowel sounds is number 4, but you all just showed me that, so I know you know how to listen for your bowel sounds. Let's see, did I take this one off?
So wait, so skip
No, I
number
didn't.
4.
No, I just know
Okay.
you know how to do it, because you already showed me, everybody passed. So you still will have to do it. I heard Dr. Yes,
Open that up to us.
yes, it's open now.
I can't open
You
it.
can't
I
open
got
it?
the notification that it
What?
said it
Oh.
was created, but it won't.
Yeah.
I can't get to it in here.
My dreams don't.
So you got a notification. Where was I? 5. Use the stethoscope bell to listen for bruits over the aorta and the renal, femoral, and iliac arteries. And this is on page 611 in your book.
See the,
Oh, you wanna see it?
arteries pretty deep. I mean, they come here. Really, your aorta bifurcates about here. Got hepatic and then renal will come right over here. Maybe it's just right into
you're
the
right.
rib
You
cage
got it. You
here.
already said it. That's just a little.
It's just a little bit here, but they're pretty deep.
And on somebody like me, they're probably real deep.
Using the bell, you're listening for bruits over the aorta, renal, femoral, and iliac arteries.
Are they going to be easy to hear, or is it going to be like included by like other sounds?
I don't like
And
listening to
here's the
anything
thing,
with
I mean,
clothes on.
for
I
me,
feel like
I
it
mean,
takes
I
away
really
my
didn't hear
ability
too
to
much
hear.
because her bowel's ahead of it.
Yeah.
And I heard bowel sounds before I heard
Everything,
Yeah,
everywhere.
it's you just learn your landmarks, because if there is a bruit, it's going to be louder. You do it to find the bruit. If there's nothing there, it's not because the arteries aren't there. They're there. They're just, the bowel just is taking up more noise.
And right now, they're really, I can hear my own bowel sound.
Percuss
I
the
ate.
abdomen. Use indirect percussion to assess at multiple sites in all 4 quadrants. Let me grab this back in the book.
Do you have any gas in here at all? Okay, a little bit over here.
Now, how can you tell she has gas? Share
The
with us what
change,
you're doing.
it sounds like you're beating on an empty drum a little bit. It's kind of high and hollow sounding.
So you're just tapping one finger.
Yeah, I just do.
Okay.
It says to estimate the organ size. I will not have you guys trying to estimate organ size.
Thank you.
Sorry.
We
Not gonna
appreciate
do
that. Thank you.
What, you mean the bowel?
No, estimate the organ size of the liver, the spleen, and the bladder.
Oh,
I'm just not gonna do that. But it's in
well,
your
you know,
book on page
bladder, if it's
611.
empty, you should feel much. If it's full, you'll feel it.
What page did you do that with?
611. Use your fist or blunt percussion to percuss over the costovertebral angle. like we did in the basic nursing physical assessment.
That's the one over here, right?
That's also on 611.
We just do like
You guys have already done that one. Okay, we did that one already. Begin with light palpation throughout the abdomen. Identify surface characteristics, tenderness, muscular resistance, turgor. Observe for grimacing, guarding, or verbal statements of tenderness or pain.
Are we really supposed to check for like turgor? Get like on our student patient?
No, I don't want you going under people's shirt.
Well, to test for turgor, you have to kind of
Yeah,
pinch
pinch
up
Yeah.
to see if the pleat stays there.
Okay.
And very few
So
people's
no.
stomachs are
We
doing
won't.
On the abdomen.
that. The only people that are going to do that are women who are immediately postpartum. That stretches skin.
Now,
Really, I think that's the only time you ever see it.
part of this is dehydration, part of it's old age.
Mine does it too.
You see it? Pinch, let go, look at that.
It is.
Like, wait a minute.
My physiology teacher said aging is just slow dehydration. That's what
It is, it is, you just kind of swivel up.
Oh, for my birthday, this is just a soapbox. My daughter got me some IV fluids. Oh, I felt so good. I was so happy. Because it was only $500, but they put all these amazing vitamins and stuff in there, and it cost $140. Pretty expensive. But usually it's 500 mLs, and I was like, no, I want a liter. So it was like $199, and she paid for it, but I felt so
Did
good.
you go to an infusion
when I
center?
Yes.
Did you
Where
go to
at?
like Blissful or?
I was in Michigan. It was
Oh,
called the
okay.
Drip Bar or something like that. But when I was in Vegas, I did the oxygen where you sit with the nasal.
Yeah, those oxygen.
So like I've been trying to do some good stuff for my life. But being hydrated, if I ever go to the hospital, it doesn't matter. 9. Use the palpation to palpate organs and masses. So this is where it gets a little tricky. So on page 613, you guys have to palpate the liver and palpate the spleen. Oh, do you want me to give you the book back? So you can see how, because they do it in a weird way to me when they lean over, but when I looked at videos, they did it the same way, so. Palpate the liver, palpate the spleen.
Liver's over here. Liver's right here. And usually you start it, because this is how I've always seen it dictated, because I never really, is you go to the rib cage right here, and it's tucked right under here. If you feel an edge of something hard beyond the rib cage, that is a clinical finding. And same thing with spleen. You don't want to press too hard on the spleen though.
And then you can like have them take a deep breath, put your hand in, and then let it out.
And it wants you to put your hand underneath too for this one. So it says, stand at the client's right side. Place your right hand at the client's right midclavicular line under the costal margin. And then place your left hand under the client's back. So she had the right hand here, but the left hand should be under the client's back at the 11th or 12th rib, and press upward just to help to bring it, closer.
Oh, press with
Anteriorly,
your left
yeah,
hand up.
To bring the liver a little further up so you can feel it better.
Like isolate it?
But you really don't want to feel much of it. Because if you do, it's enlarged. What happened?
That's
Anatomized. It says, or you could use the hooking technique. Place your hands over the right costal margin like she did. Put your fingers over the edge and have the client take a deep breath and feel for the liver's edge as the liver drops down on inspiration and rises up over your fingers during expiration. So those 2 different techniques that you can use. Either one I'll be fine with. You can choose whichever one you want to use. Then for your spleen, does it still stand at the right side? Yep, stand at the right side. Reach across the client to place your left hand under the costovertebral angle and pull upward to move the spleen anteriorly. And then place your right hand under the left anterior costal margin.
I'll scoot over.
And I have long arms.
There you go. During exhalation, press your hands toward inward to try and palpate the spleen while she's exhaling. So you will have to know when you're doing what. If you come into the MPC and you're like I don't know if she's supposed to be taking a breath in or out. You'll probably lose that point. So just make sure you know when you're doing what, when you're palpating the organs. All right. Oh, that's it. Record the procedure and the patient's response. Wash your hands. Normal values. Student is able to verbalize normal findings. Usually I'll make everything normal till we get to the end as you're learning.